right, guys. So as Jordan mentioned, I'm Casey. I will do a little rundown for you guys on the digital scanners that New Smile is offering. We'll jump into it. A lot of my intro stuff is in here. Throughout the lecture, as Jordan mentioned, give questions, put them into the chat. We will go over everything at the end, and I'll try to be as explanatory as I can throughout to try to minimize them. Afterwards, if you guys are done going through the lecture, you write down notes, you have some questions, whether you have the scanner or are looking to get it, my information will be at the end as well. Feel free to email me. I'll get back with you in a really timely manner, and I can always jump on a call or just answer some questions over email. But I'm going to roll right into it. So a little bit about myself. This is my wife and my 3 kiddos. This is my practice. I'm from Florida, born in Florida, raised in Florida. All my schooling was throughout Florida. I hit most of the universities in the state. I did do my university or my residency at the University of Florida in Naples. I've done a lot of organized dentistry stuff. Now I'm just a private practitioner. I run Smile and Pediatric Dentistry in Apollo Beach, Florida. We're just outside of Tampa. And I run a tongue tie center there as well. Have not found a way to use my scanner for the tongue ties, but we use it in the dental side every day. Objectives tonight. So we're going to understand there's the benefits of digital scanning as opposed to traditionals. We will explore some clinical applications that I've used in my office. The thing that I found to be cool is you can use it for a lot of different things and think outside the box with it, especially on tough kids or tough kind of situations clinically. We'll learn a few scanning techniques for you guys. A lot of it is a practice makes perfect, but it is a very simple device to learn to scan with. And then we'll go through some of the workflow of like your scan, how does it integrate to your lab? How does that get back to the office, and just how to make that a cohesive thing. And then we'll talk about the nuts and bolts of the finances of it. Obviously, as practice owners, you have to make investments in your business, and we want a good ROI when we're making those investments to know like what we're putting in the office is going to be beneficial for us, our patients, and the bottom line. So we'll hit on all of those throughout the lecture tonight. So why am I here? It's because Jordan asked me. No, in all reality, like I jumped in and got a scanner back in June of 2023. It was something that years before I was looking into, had been kind of talking with my general dentist buddies, people that were already scanning, my ortho buddies, like what are they using? iTero, Medit, all of them out there. There were so many to choose from. When I got wind of this scanner, it was introduced obviously on the pediatric side, which is a little more facilitating for me. Ended up bringing it in June, and I have not taken an alginate impression since. It's been a really good piece of equipment in the office. It's been an awesome tool for my team, and we'll get into a lot of that. I like it because it integrates really nicely into the workflow. I spend zero time kind of messing with these scans in the office, as opposed to a traditional impression appointment where it was my fingers, my hands in the mouth most of the time on the tough kids that my assistants couldn't get a good impression on. That was diagnostic. And in my office, we're really big on trying to stay ahead of the game using technology. I want the best for my patients. I want the best appliances made for my patients, and I want it to be seamless. So when people come, they know they're getting that top tier experience. And that's just part of our process at Smile In, and it's really helped us to facilitate that. So the biggest benefit for me is the non-ROI related, no horrible impression visits. My dental assistants can do all the work. Learning to scan for them is very easy. What I've learned is the younger your team member, the quicker they're going to get it. If you have some more veteran team members that are older than you, it might take them a little bit longer, but it's like anything, the more you do it, the easier it becomes. When we integrated all this into the office, I picked one assistant who was very tech savvy and had a little more orthodontic understanding to set up a kind of just a template, like, how are we going to open the laptop? How are we going to connect the scanner? Just the nuts and bolts of the step-by-step. That took her like half a day. It was like a little project I put her on for the day. She was able to put it all together. So we had an SOP for the office. We laminated it, put it in a binder. Now, if any new assistant comes in, they literally have a step-by-step protocol of how to do it. And it's extremely simple. The learning curve for them is more just a practice and do. So we had them work on each other a lot. We had them practice in lunchtime, scan, watch people scan, get tips from assistants. But in our reality, it's simple. I had not done a scan myself, like a full arch, double arch, full kind of impression scan since I really got the scanner, because my girls became so good at doing it for the patient. But this weekend I was in scanning my son because I'm doing a little phase one aligner case on him, and I didn't have a lot of time to get him to the office before I wanted to submit it. I plugged it in, got on there. Within two minutes, I was scanning them, and I hadn't really looked at it in over a year and a half. So it is really kind of like riding a bike. Once you learn to do it, it's simple. But I never had to dread like that really gaggy kid taking a full arch impression for an enhanced or lower lingual, and don't have to worry about those dreaded appointments for myself or the patient or the parent of the patient. We don't have to worry about stocking those supplies anymore, which is huge. And everybody's happy. Like parents are like, wow, this is really sweet. I didn't know they had this for kids, and it made this appointment very nice. And then overall, it's just, you're going to get a really good feedback from your patient and your parent. The efficiency is awesome. Like the accuracy compared to an alginate, you can get a great PVS impression. You can get a great alginate impression. But when you're doing the switch from I poured it, I sent it to the lab took an impression of that potentially, all of those little stepping points. All of us went to dental school. You know, you can have a slip in the alginate, a bleed in the stone, and then you're going to have not a diagnostic impression. The accuracy of this makes it so smooth on the impression front and then the appliance fabrication front that everything drops in first time, every time. I have not had one appliance that I've made that has not fit perfectly, where I've had to bend a wire, pick up a bird beak, or pick up a 3-prong and bend something, as opposed to my traditional lab technique where I had to do that a lot. Also, that just facilitates faster chair time. You're going to have a quicker impression appointments, quicker insertion appointments. You can put more productive procedures in those time slots and not have to worry about blocking a full half hour for an alginate impression. The compatibility with other technologies is awesome. Like there's no limited sourcing like you have with iTero or something like that. You can use any lab you want. If they take an STL file, you're available to use them. I utilize NeoLab, which is partnered with them, and I'll talk a lot about NeoLab, but in all reality, I've used other labs for more fancy techniques. If I'm doing like a silicone suck down for some lateral buildups and I want to do a nice wax up for the parents, I can utilize it for that too. So there's no real kind of hindrance in which lab you use. And the more you start playing with it, the easier it is to kind of integrate into not just your appliance and aligner therapies. You can use it for other techniques in the office as well. And I love the indirect banding aspect of it, especially the 3D printed bands, which we'll see some pictures of. You just take the scan, send it out. They 3D print the model, and then they 3D print the appliance right on top of it. So it fits perfect and comes back nice and clean, and makes your life a lot easier in the long run. So I chose the AS200E really because it was wireless. I didn't want cords. I like a very clean office. I don't like hoses everywhere. I don't like things getting caught and dragged around. One, because we have a lot of kids running around the office. There's always a sibling in the room. There's always somebody running around. You have multiple assistants moving through the office, and I don't like things getting caught. The lightweight aspect, it's very easy to hold in one hand and manipulate as you're kind of going through the arch and not having to worry about it kind of being a burden on your wrist weight-wise. The size of the tips are differentiable in a sense. Like you have a bigger adult tip that catches more kind of surface area per scan. And then on your smaller kiddos, if you really need to get a good scan, you can switch to a smaller tip, which is really conducive to pediatrics, because we have some older kids with really small mouths, and an adult size tip that might come from a more traditional scanner just won't fit well. The laptop was included. That was big. I didn't have to go do some tech search or call my IT guy and wait for him to get back for me for, oh yeah, this is compatible, but this isn't. I knew it was going to be a plug and chug, open the laptop, get the software going, and it'll work right away. There's a great warranty with it. You got 3 years with the warranty. I've never had an issue with mine, and we use it all the time. And it's being used by 5 to 7 assistants differently in different rooms. So we move it around on a little cart and just keeps it easy. We keep everything in one spot. The interface is, like I said, super easy for your assistants to learn from. That's a huge thing because when you're putting new things into a practice, some people are kind of hesitant with that. My practice knows, like, if we're not moving forward, we're falling behind. So we are big on always changing. We're always going to be changing for the better, getting better and making sure we're bringing the best to the table for our patients and our parents. And that was a really easy thing to do, even for my older, stubborn assistants who are not fond of technology. They were able to implement that really well. We already talked about the tip, and that's something I love about it. There's no recurring costs. That was one of my biggest hindrances with a lot of the softwares that were available scanner wise. You pay for it and you're done. You're not paying a monthly bill. There's nothing you have to really follow up with. It's just buy it and use it. And then we've mentioned before, but the open architecture makes it integrate really well with other systems. There is the partnership with NeoLab Junior. They've been an awesome lab. I've utilized them. I use them at first really because of the ease of compatibility. But they've turned out to be a wonderful lab. I have not used any other lab for my space maintainers and normal appliances since switching over to the Allied Star scanner. We'll keep it rolling. So this is just a nice breakdown. A lot of people like to kind of take a picture of this, so I'll leave it up for a minute while I'm chatting about it. It just gives you the bare bones comparability of what you're getting when you're getting a scanner, what you're paying up front, what your monthly subscriptions are, if there are calibrations, tip size differences, and then is it really made for pediatrics? And obviously the AS200 or 260 and the AS200E both hit that. Your wireless is going to be a little bit heavier, but it's still nothing in the hand. Your handpiece feels pretty similar to having that in your hand, and in all honesty, your assistants will be using it more. So it's less of a doctor ergonomics issue. I love the wireless one just because, like I said, I like it clean. It was worth the extra money for me to have that little difference. I'll leave this up for one more second as we're going through it. Cost effective wise, obviously makes it a little easier there. You can get some used scanners. You can get some other scanners on the market that are getting lower in price. But for me, just working with New Smile and having the NeoLab component all integrated in and having the tips made it a no-brainer for me. So workflow, like this is our day-to-day. I kind of break things down in my office to time in room, time in chair, and like when I'm actually in the mouth. So I don't like kids sitting for a long time. We all know kids, they're antsy. They don't like to hang out for too long. Having an impression taken, especially if it's a dual arch impression, it's tough. Just getting the alginate in, letting it set completely, getting it out without disrupting your patient too much. But the time in the chair is minimal. Most parents are not even done just getting the kind of toothbrush and paperwork from my assistants at the end of an appointment before we're already scanned for an appliance that will deliver when we take a tooth out or something. So the scan's super easy. No more pouring models. If you use PBS or alginate, obviously you don't have to pour a model, but a lot of people are still using alginate and stone. This takes a whole segment of your laboratory and kind of transfers it to some other use that you can use it for, because you're not having to worry about stone and holding those models, and all of your inventory model wise is in the computer. So you don't have to worry about having those stashed somewhere in your office like we used to for records, which makes it very, very easy. The kind of uploading the files, really simple. We will walk through some of the templates that are integrated with NeoLab so you guys can get an idea of kind of what that looks like, the flow to it. It's very click and go, very simple. Anybody that can read and use a computer can get through it with almost no training. So after they do, your common 3 to 4 appliances or space maintainers that you do, they can kind of walk through that really simply. And then the shipping back and forth from the lab, really quick. You only have a one-way cost because you're sending everything digitally over to your lab. So you don't have to worry about that back and forth shipping cost. They still do the 3 times a week kind of shipping. And then over time, you're going to pay for the scanner itself within 2 years, because the staff timing, your material costs with your alginate, your trays, and everything else included, it makes up for itself ROI wise, just in having the simplicity and ease time wise of doing the digital scanning workflow. So we'll talk a little bit about the scanner laptop setup. Like I said, I hadn't touched the kind of scanner or laptop in about a year and a half, because my team does most of the setup for me in the office. And this weekend I was like, man, this is like, you go into the office on an emergency day and you don't know where anything is in the office. That took me longer, was finding like, where did they put everything? Where's the charger? Like, make sure everything's where it was supposed to be. That took way longer than me setting up the scanner and getting the laptop open. We will kind of talk through some of that. There's a slide coming up that Jordan's going to hit on some of the setup, but you can troubleshoot a lot during your scan. And this happens no matter what. You're going to have somebody move, you're going to lose your place. I had my dental assistants practice on each other a lot, and on typodonts too, just so they get the kind of wrist movement down, where that kind of sweet spot is. Adjusting the patient and doctor positions helps tremendously when you're moving quadrant to quadrant. And that just comes with kind of practice and dexterity. And then the reorientation is very simple. So like if you lose your spot, and you'll see on some of these, you just kind of float back over somewhere where you have scan, and the computer picks it up right away. And then you can just kind of keep your flow going, and it makes it so much easier. I remember working with one scanner in dental school, and I thought it was so tedious because I kept losing my spot and it didn't pick it up easy. But doing it on my son this weekend, we were in and out of his scan in just a few minutes, and I had to do an upper, lower, and a bite for him because we're going to do some phase 1 on him. So Jordan, I'll let you kind of talk through this, and it's a little video as it's going.
Yeah. So this is basically just the setup. This is the wired scanner. So you'll see we have, the laptop there. What I'm taking out, that's the power cord. You just pop it in, just USB, and then that's a little holder. So you'll just plug it in. As soon as you plug it in, everything is connected. So as soon as you see me kind of plug it in there, light will come on, and that guy's starting to connect. Plug on a scanner tip. Right there, I'm just creating a new case, basically saying like, Jordan demo case, whatever it is. Switch over to, for a pediatric patient, and like that, it's already connected. Just to kind of show you what that might look like. And again, that's like the entirety of the setup. You literally plug it in for the wired scanner. As soon as new case, go to scan, and it's set up for you right there. So you just start scanning. The wireless is a little different. Only difference being you'll have it's called a TP link. You essentially just take that, open it, plug it into that USB port as well, and then you turn on your wireless scanner, and it's connected that way. So that's the only real difference when it comes to setup. Would just be one is wireless, and you want to make sure you have that TP link plugged in. And then with the wired, again, you just plug it in and you're up and running. So.
Yeah, and it is exactly the same with the wireless, other than the TP link. It looks like a little USB. That's all it is. It just plugs in the side, flips up, and it's your little Bluetooth kind of connection to your scanner. That's what took me the longest to find. They had it in a little tip-out bin, and I didn't know where it was. Move through this. So this I'm going to play through. It's one of our patients going through a full arch scan. I think it's sped up. Yeah, it's sped up a little. And this is one of my assistants just rolling through and getting the scan. You do kind of like you're brushing teeth, have them bite down a little bit when you're hitting the buccal corridors, and open big when you're getting the palatal and occlusal aspect. It will show you on the scan if there's any data missing with a different coloration there. Makes it very simple. So the kids love seeing it and kind of looking at their model on the screen. She finished the upper, rolls right to the lower, and similar process. We're just getting our anatomy in there, and depending on the appliance you're making, NeoLab does have a nice little chart. I think it's in the slideshow that we'll look at. And it kind of just is a cheat sheet for your assistant. So they don't have to be super, super savvy on the dental anatomy of things. It's like, hey, if you're making this appliance, get this scan, get the palate, or no, we just need the teeth. If we're doing a full kind of ortho case, obviously we'll want bite too. So kind of just get you all that. And obviously that was sped up a little bit, but Simple scan, upper lower arch. You have them closed for the buccal corridor. Get that bite, and the computer integrates everything in there. Makes for a simple process. Parents are very wowed by it because it looks cool. Kids love playing with it. I'll usually give them the scanner and let them like flip it around and look at their face. And it's just a good way to kind of get them engaged with the appointment. It's also a great tool. Like you can scan, and like if they got a big rotten tooth, you can show them like, hey, yeah, this is where the sugar bugs are. This is why we're doing this. We need to hold the space here. So it's great for patient education and parent education. But the tech itself just makes it super easy for everybody. Forward, and this is another, this was like a training at another pediatric dental office, having their assistants kind of play through things, and it'll set up. That's just it. Meaning it's scanning and catching everything. And this is what we had my team do. Let's sit down before
you have to
work,
go back to an already scanned area
after work,
to pick it back up.
and she's showing how to like go pick up the spaces that they missed. And it's just a practice makes perfect thing, but it's very simple if you've ever played video games, and most of your younger team members are more kind of digitally savvy. It makes for a very smooth kind of learning process for them all. But that's my recommendation. If you do bring it in the office, just be like, hey, before work, you guys do this. After work, you guys do this. During lunch, like play with each other. Oh, a patient canceled. You guys go in the room, scan each other, just get some practice, and we'll check out the scans after. And it's good for new team members to just play with. Now, after your scan, typically, you got to do your lab script. NeoLab is who I use, the New England Orthodontics Laboratories. They do have the junior, which is more the pediatric division, but this is your interface that you see. All these templates are kind of preset, and you can customize this as to what you want on your kind of home screen for what you use traditionally. What are your most common appliances? Most of my stuff is already preset for almost everything outside of like the patient's name, date of birth, and that info. Most of mine are very similar. I'm not going to make a lot of modifications. You can definitely make customizations, obviously color changes to your acrylic or any buttons you place. You can modify things for odd dental anatomy. I had a case the other day where I had a kiddo with an ectopic 3 under A, and I could see the majority of 3, but it was a patient with autism, and it was very difficult to kind of see everything. We were able to get a scan within 2 minutes. Like that was probably the easiest point of the appointment, is just him like seeing his teeth on the screen. He was really engaged with it. And I didn't have a full coverage of the occlusal surface of 3. So I called the lab and I was like, hey, I want you guys to fabricate a custom 3D printed kind of top cusp coverage band. And I'm going to show you guys some examples of that throughout. It has a really cool kind of 3D printed intaglio that is micro etched that allows for really good bond strength. If you use like band lock or your Fuji ortho blue band kind of ortho cement, it'll integrate into that really well. And it's a really strong hold, and you don't have to worry about getting all the way subgingival, which means delivery is a lot easier. My goal with that case, and a lot of my tough cases where I'm using that like kind of cuspal coverage, is either I'm going to have to cement it on a kiddo that's not going to want me to stimulate the gingiva after we get the tooth out, maybe with sedation, or if I'm going to sedation and prep, I'll have the appliance scanned and fabricated. So while we're under, I can cement, do my work, or get the tooth out, place some gel foam, and then cement the appliance. But this is kind of what your interface looks like. It is a little video, so we'll kind of let them roll through a little bit of this. A Nance, obviously a very common appliance in our practices. You plug in your patient's name, start rolling through it. It is all pretty customizable. Down here, you can place a lot of fancy things. Most of the time, it's going to be the same. You're going to put 6 to 6. You're going to pick your little acrylic color, depending on what your patient wants. If you need to hype up that appointment and delivery a little bit more, you can customize where your bands go. It's really just a plug and chug lab script. If you do have some custom things, you can put it in that design instruction down there. And if the lab has any questions, they'll call the office and kind of run through it with you. I've thrown them some really oddball scans and been like, hey, I know this is off. I know there's a wedge in that scan. I know there's a band on that tooth. I don't care. Print it anyways. Make this appliance, and they'll do it for you. That's it though. Like they're done with the script. I read it over, make sure everything looks good, quick, 10-second glance, hit submit, boom. My time with all of this is about that 10 seconds. My team does the scan, they do the lab script. I look them over at the end of the day and press submit just so I know it's all going correct. They have everything you can think of. They're an orthodontic appliance lab first. So from a pediatric side of things, anything you need is there. This is the habit breaker script. Very similar to your Nance. You're going to have all the same kind of drop downs depending on what you're doing, where you're going to attach your bands to, and you can roll through it. I hadn't done a Halterman appliance in a long time. I just scanned for one today, plugged and chugged it, and it was out within a minute. My team was able to kind of make that new script really quickly, just based on what NeoLab had integrated into it, which made it very facilitating. And again, this is your lower lingual holding arch and the same kind of presentation. All very simple, so your team can get used to it quickly, chug these out quickly, and make sure that your scripts come back in a timely manner so you're not having any delays on delivery. Outside of that, I'll keep it rolling because these are all pretty similar. And we already kind of rolled through the Nance on the video. I use this as like a cheat sheet for my team. This gives them, hey, what do I need when I'm scanning for one of these? Do I need just a horseshoe? Do I need the full palate scan? Obviously, abandoned loop, you're just doing a quad. This makes for a very simple kind of scan process. Your team doesn't have to come ask you if they're new or if they're less versed in using it or what appliance you're using. You may call out an appliance name and they've never heard of it or they're not sure of what it is. We just kind of keep this with the actual little cart we have with the scanner. So if I say, hey, we're doing a mouth guard, they know, get the full palate. So everything can sit where it's supposed to. Most of the time, we're doing full arch scans because we're doing lower linguals and Nances a lot with these. But just a nice little cheat sheet. And I would say use this even if you are using a different lab, just because I think you're going to need the same info. And it's something that NeoLab kind of gives to us as a benefit. So these are the different band options. So I utilize the ones on the right the most, the 3D SLS. And these are the fully 3D printed stainless steel appliances. I use this because it makes it not have to go subgingival. You don't need to place any separators. You don't have to worry about placing the band, taking off the band, doing your scan, mailing that in. I used to do that a lot with my more traditional technique. I loved placing my own bands because I liked to contour my bands into my grooves and embrasures and make sure I had a really snug occlusal fit. As soon as I got my first like 3D appliance back and saw how like kind of perfect that mold was to the cuspal shapes and grooves, and saw how easy the insertion was, especially for your really sensory heavy kids, it makes your life so much easier. So I don't do doctor fitted bands anymore. I don't do indirect often. A lot of times I'm going to do the SLS just because I've had good success with them fitting really well and then also staying on really well. Using band lock will be your best bet to get a really, really strong bond. If you've ever used band lock, you know it's really strong. And you don't see a lot of debonds. I don't see any more debonds with these than I did with my traditionals, where I was using just Fujisim 2 to kind of glue it in. Those kids that get it off, it's the same kids. They're chomping on Tootsie Pops or chewing Starburst or Swedish Fish. It's always the same story. I like this because I'll show you some images of the intaglio of it. It's all micro etched, so you get a really nice kind of bond to the tooth itself. And this is just a comparison between like your traditional fixed band and how you kind of place it. We've all done this a million times. Seps, cement, cure, clean up, and then we're debonding with our band remover. You don't need to place seps with the 3D SLS kind of fixed ones. It's all CAD-CAM designed and 3D printed in the stainless steel. So it fits just on the cuffs in a sense. I'll show you guys something in a minute. The NeoLab did just send out a new kind of offering that they offer for their actual band types, which is really cool. Kind of looks like the little 3/4 cuspal coverage that I did for that patient the other day when I delivered in sedation. It just makes it where you can like think outside the box if you have a tooth that's not in a perfect position, or if you need something that's going to be a little stronger bond because you have a kid that is going to maybe wear and tear on that appliance a little more, you can have different options associated with it. This was one of my little scans that I did very early on, and I made a little band and loop for a patient. This was where I didn't do the 3D SLS printed model, but I just had them make the band indirectly and solder it all together. It fit perfect because the 3D model was a really good replica of my patient. And I just did this before a sedation so I could cement it during sedation and not have to fight the kid afterwards to get it in there. But just a little kind of glimpse of what a traditional band and loop model looks like as you're getting it back from the laboratory. This is my more traditional lower lingual holding arch style. You see it fits just like a normal lower lingual holding arch along the lower incisors, but this middle picture shows that flipped version. And if you ever are at a conference and you see Jordan or anybody at the table, take a look at this on the intaglio because it looks like it's kind of like sparkly, kind of diamondy, and it's all just micro etched, three-dimensional or 3D printed wise. And that's what really allows your bond to stick to that lighter surface area that you're going towards. I love having these fabricated for sedations. I'll usually try to scan 2 to 3 weeks before and then get it cemented the day of extraction. If I can't do that and it's not a perfect world, I still do this because on those really tough kids with like a big distal operculum or a lot of bone on the distal of those sixes, you can use this and get it cemented without impinging on that tissue. So the kid doesn't really feel it in the mouth on the tissue. And everybody that's in pediatrics knows like trying to seat that band on that delivery day on the distal of those sixes with a big inflamed operculum is always really difficult. This has made my delivery appointments so much easier. Once the kid opens and they feel it sit for the first time, all fear is gone because they're not worried about stimuli. The only thing else we have to worry about is taste of the cement. And we can get through that. This was like an oddball case. Now I wouldn't do this because I used the chairside kit from New Smile. I did not have the chairside kit when I did this case. This was a girl who came to see me. I think it was like a day before one of my sedation days. I don't do oral conscious sedation. I just do IV in the office. So I knew I needed a space maintainer. Her six had a thick distal operculum, so I knew a band was going to be a nightmare because it took us a long time just to get this initial PA before we got her in for IV. And her lower incisors were not erupted. I think she had 24 and 25 in, but N and Q were still present. So I didn't want to place a lower lingual holding arch knowing I'm going to have to take that thing off potentially, and this patient's really tough. So I kind of rolled outside the box and said, hey, Neolab, make me that 3D SLS just cuspal coverage band and loop and fabricate it for me so I can deliver it after I get this tooth out. So we got the girl in the next day, got the tooth out, delivered this appliance. And in my head, I'm like, this is not going to work. Like, this is not going to hold up. It's been over a year and a half, knock on wood. It is still holding up strong. We've built a lot of confidence in the girl, so I know if I need to fabricate something different now, I can. And she does have her lower incisors in now, so I know we could get that in there if I need to modify it. But it is still holding strong. I think I saw her last month, and it's still looking good. I said, Mom, we're not poking the bear. It's holding the space. That's all I care about. If it comes loose, we'll fabricate something different. But it does give you the ability to kind of think outside the box and get some space maintenance done on kids that traditionally you may forego space maintenance just because you don't want to battle and kind of fight through those deliveries. This was another tough case. The kiddo, very sensitive. I think this was a patient with autism. That you can see radiographically how that band does not go subgingival. So we got the tooth out, and delivering this was a breeze. The kid was cool getting it in. I did have to clean up a little cement on the backside of it. But at the end of the day, space was maintained. The patient was happy. We got the infection out with the ability to maintain the space. And with patients with special needs, that's not always the case. We talk a lot about, space maintenance is a privilege sometimes. But for me, I try to maintain that space in these kids as best as possible because we all know ortho compliance is going to be much lower than a space maintainer delivery appliance and a removal appointment. So if I can keep things where they're supposed to be by making it a little simpler for my patients, I always will. This was a kiddo. I had my team do a video of this. This was me playing with the scanner, and this kid came in. He had like an abscess on A, I believe. This is supposed to be playing. I'm going to see if it's there. It goes. We talked about getting the tooth out the same day because he had an abscess. He was in pain. We wanted to get the tooth out, but obviously I wanted to scan for the actual space maintainer we needed to make. So we're in there. We're getting our scan done. I had already numbed him with my SOAN. Another shout out to New Smile. He had no idea that was done. I scanned and then got the tooth out. We were in the room and me in the mouth for, I'd say, 7 minutes, and we were done. Impression done, injection done, tooth out, patient happy. A couple weeks later, we got it delivered, and still seeing this kid, and this was last year when we were going through it. Now, you will pick up blood and stuff when you're done injecting sometimes. A lot of times, if you're just doing an appliance, it's not necessary to have a super clean field. If you're concerned about blood after an extraction, pack some gel foam, or let a kid bite on gauze for 15 minutes, go do some hygiene checks, come back, and then do your scan. If you are doing more of a aligner case or you're doing an Essex of some sort, yeah, you're going to want clean teeth. You're going to want the field clean so everything kind of fits really nice onto the tooth structure. So you want to make sure everything's spick and span there. But the mom was really impressed with this because we diagnosed, got him in the back, had him numb, impressed, and out of the room within 15 minutes. So she was stoked, and we were able to do that kind of a same day emergency for the kiddo. Happy parent, happy kid, happy doctor. This is just another example of those thick distal operculums on the backside of the lower sixes where you're going to need to place a lower lingual holding arch. Obviously, K and T are not doing well, and we needed to extract. And I was not able to place those distal bands subgingivally, so we did the same kind of case here. It just makes those dreaded delivery appointments so much easier, and then the impression appointment that much easier. A lot of times I will do my scan in the mouth during my sedation. My IV docs have loved the transition to a scanner versus a full arch impression because I do open airway with an anesthesia group. So we need to protect the airway the whole time. If you're putting a whole tray of alginate in the mouth, you are going to push on the floor of the mouth. You're going to push the tongue. You're going to kind of push your throat pack a little bit further deeper, and you don't want to obstruct airway. So having this in there makes it so much easier. I have the anesthesiologist give a little bump so it loosens my patient's jaws up a little bit more. After I get them open big, we can get our scan done nice and easy, and then deliver once the patient has healed a little bit after a few weeks and are feeling a lot better and not any more discomfort. This is something new. What I'll have to do, I'm going to have to stop sharing this. I'm going to open this in my browser and I'll pull it up. They have integrated kind of an AI component. So I'm going to do this real quick and get you guys over to it.
Yeah, and I'll mention just a couple things about this, Casey, if you don't mind.
Yeah, go for it.
So this is a new application within AS Connect, which is your, patient software, your kind of main hub. Bunch of different applications in there. So like when Casey was talking about doing that phase 1 for the aligners for his son, I'm sure you used ortho simulation in there. But basically you scan a patient, you within their file, you open up this application, and it's going to generate an oral health report based on your scan, all done through AI. And then you can go through just like this and kind of edit and mark teeth, tooth color, caries, everything like that. So it's a new application that they just added that's pretty awesome. So I wanted to add this in here and kind of be able to show you what they will do.
Yeah, Chris asked me if I had seen this, and I hadn't. And just earlier this week, I was playing with it. It's something you could train your assistants to do, especially if you're doing more of a comprehensive treatment plan on a bigger case. Obviously, most of our stuff on our younger patients is really bread and butter and straightforward. But if you are doing a more complex case and you want to really be able to show the parent a little bit more of like what you can get to and what's really going on in the mouth, utilizing the scan that you already took will get you there. And this just helps facilitate a lot of that as you're plugging and chugging through it. This is all in your main hub with the scanner itself. And then this is kind of your final report. So you can kind of show the parents like, this is what's going on. These are the areas we need to address and what we got to get to. So if you're wanting to have like a treatment coordinator put together a big presentation, you can train them to do this. They can pull the software, put all this together in the background and have that ready for your mom to sit down and kind of walk through really what's going on in there. So just a little added benefit for what you guys can utilize this for. And then I was telling him, so let's just kind of showing your comparisons, what you're going to get to ortho simulation wise. And then obviously you got to clean up caries control before you can really get that all going. So it's just a good little blanket snapshot for the parent to understand where you're starting, what you need to do, and where you really want to get to. And parents love this stuff. Just more visual for them, and for me, it's really good for patient education, so they can really visualize kind of what's going on in there. When I was talking about those special coverages, Neolab just sent this. So I do this traditional standard band. That's your like 3D printed band. They make it now where they offer these different shapes and sizes and coverage preferences depending on what appliance you're doing. So really, they can 3D print anything. If you can get them to design it on the anatomy of the tooth that you have, this will get you to where you need to go. I'm going to utilize some of this when I have certain situations, and I called them and had them do a customized kind of three-dimensional where I had them like take this aspect off and they just rolled it to here because I couldn't see the mesial marginal ridge of that tooth. But this is just some of the benefits of the 3D aspect. They can really customize those. And if you have something to work around like a bracket or something like that, you can make it happen. I'm going to stop sharing this and get back to our presentation for everybody. Right, and we're back. So after the clinical aspect, really talk about the money. Like it really comes down to ROI for a lot of docs as to whether they're putting new tech in the office. Your tangible right off the bat benefits. We talked about no more trays, no more material costs. Like I still stock some trays and I still have some alginate in the office just in case I need it for an outside the box thing. I haven't had to use it and I don't have to continually stock it on a consistent basis. And it takes up much less room in our storage. And we all know storage in the dental office is limited. So that's a really nice benefit. My remakes have been none. I have not had to have anything remade from Neolab, knock on wood. I think it really comes down to just providing the scan that they need. And if your assistants are trained in using the little cheat sheet, they're going to be able to do that. You're going to save on lab fees not doing remakes. If it's the lab spot, obviously you can kind of battle with them and say like, well, you guys are covering this because this was on you. But a lot of times you're still paying shipping, you're paying for the time delay. You may get an appliance in and it doesn't fit. Now you have to reappoint that schedule. Now you're losing another chunk of production time. For me, I try to make every kind of minute in the office valuable for the patient and our office. I want the business to run profitably and I want parents to come in and not have us wasting their time per se. So not having any remakes and having a really clean fit helps on that a ton. The chair time is invaluable. Every chair should make you a certain dollar amount every month. You should know what that number is. You should have goals that you're getting to. And it doesn't mean you have to sell a lot of dentistry. You just need to prevent a lot of dental needs. And you can make a lot more money doing hygiene checks than you can taking impressions. For me, I'd much rather put a kid in the chair that I can make sure is staying healthy as opposed to fighting a kid for an impression. we can fill this appointment up, like the appointment slots are really short. So if you're in a very high flow office, you can plug one of these in a 15-minute slot and know that your scan's going to be done and you're going to have that patient out of the chair and the room turned over by the time your next appointment is ready. The model inventory for big ortho offices, if you're doing a lot of aligner cases, obviously, if you're pouring or keeping models, doing PVS, that makes a big difference in kind of your storage capabilities. Not having to worry about where what case is. You can just go to the computer, pull up the name, and you have the models right there in front of you. Makes it much easier, so you can go kind of retrospectively look back at where a case started if you need to. And obviously, it's just fast. Impressions fast, deliveries fast. You're not waiting on pickups and deliveries because Neolab is extremely efficient with that back and forth. So that's all kind of like what you're going to get right away after you integrate it into your day-to-day office. Long term, it gets me thinking about like, well, I can do this scan so easy. I can get that impression so easy. What else can I offer to my patients? If you're versed in orthodontics, or you had a lot of orthodontic training in residency, or you've done a lot of continuing education on it, it facilitates that next step. Like we started doing simple class 1 malocclusion cases with OrthoBrain. It's a aligner company that uses 3M aligners. I'm doing a phase 1 case with them with my son as my guinea pig because he was really into it, and he needs a little movement of 7 and 10, so his canines can come in. So that's helped with me kind of taking that next step into opening other production avenues for the office. Parents want to be in your office for these things. They don't want to go to another doctor and have to deal with another workflow. They're usually very comfortable with where they're at, and they know how everybody works from the front desk to the back of the house. So being able to integrate that into your practice makes it a very good long-term ROI. I'm taking more ortho courses this year because I want to expand that a little bit more, and just bring some more revenue into the office to do things that I'm trained to do. I just didn't do a lot because I didn't feel like taking full arch impressions and battling all of it. But when you know you can get an easy impression and a nice fitting appliance, you can do some very simple orthodontic work for your patients and really benefit them. The procedural confidence is higher. So like when you are presenting those treatment plans, you're a little more kind of confident in the ability to educate your parent and the kiddo on what's going to happen, which in turn makes case acceptance more available for you guys. And then marketing, always like if you bring a new piece of equipment into your office, if it's part of your technology, make sure you're kind of putting it out there for your patients, whether it's on social media, your website, talking about it in the office. I always let parents know when we bring something new in, why we did it, why it's benefiting our patients, and then show them what it does. And that's going to be not only good for people perusing your socials or perusing your websites, it's great for word of mouth. Like you want every mom in the neighborhoods to be talking about how cool it was at your office and how easy it was for Joey to get his mouth guard made or something. So for me, it's really nice on the marketing side of things. And then your referring dentists are going to see your work and they're going to go, man, that's a nice looking appliance. It's super clean. And obviously you want your referral bases to have confidence in what you're doing with your care for their patients as well, especially if you guys are just taking care of some dental work and sending them back to their traditional dental home. So purchasing options. I'm going to let Jordan jump into this because that's more his wheelhouse.
Yeah, thank you. So as far as purchasing goes, you're looking at them. I handle all of this. So, if you're interested in purchasing, reach out to me. I'll get you all set up, send you whatever quote you need, anything else along the lines. But I actually need to get this updated for you, Casey. So that price is the base price without the laptop included.
Okay.
So we now kind of have like two separate line items, but that told me I should have got you the updated version of this. So if you already have, high functioning, kind of computer able to do everything, you don't need a laptop associated with it. How Casey talked about his tech team and everything. Well, then you can go forward with that option. But we strongly, strongly, strongly recommend having designated a laptop, being able to run the specs needed for it. So purchasing options, there's two options. You have the wired scanner, which I showed in the video setting up earlier. Then you have the wireless model that Casey uses himself. So two options there, and I can go over everything, with you as far as those. But essentially, they're, pretty much the same thing, just one's wired, one's wireless. Wireless is a little bit heavier, again, due to the battery inside, but still only at 245 grams, so very, very light when it comes to that. And then your consumables, pretty much the only thing that you'll purchase down the line would be scanner tips. So you either want a pack of two smaller tips or a pack of two larger tips. And again, they'll just be right here through New Smile. We'll process that order and have everything shipped out for you. So if you are interested in purchasing, getting a quote, whatever it may be, reach out to me. And I'll send you whatever you're looking for. And then, pretty simple as going forward with it. So, and then jump on the right side here. So each scanner does come with four large tips, or that actually was the former configuration. So it's three larger tips, one smaller tip now. And then again, really, really important. You get unlimited training support onboarding with Voxel is kind of like our tech side of things. So they'll jump on, they'll walk you through, hey, this is how you set up a lab. This is how, you send off your orders. This is how, anything you really want to know, they can walk you through. They're incredibly, incredibly tech savvy when it comes to integrating this within your practice. If you're doing 3D printing or whatever else, they can walk you through setting all of that up. And then last, the tips are autoclavable. You can use them, I believe minimum is 80 times. You can use them quite a bit longer than that. If you put like a cotton gauze case here, are you doing this where you put like a cotton gauze over the mirror, toss them in the autoclave? Yeah, that'll prolong them quite a while. So they're going to last you a while, and they're pretty inexpensive when you do want to replace them or just have some extra on hand. But that's about it for that.
All right. And then these are your contact points for Chris, Jordan, and Aaron. I'll leave this here for a second. When you guys are looking to purchase this, obviously it's a bigger piece of equipment. We do recommend talk to your CPA about that Section 179 and the tax code. Take it as an expense. It's an investment for the practice. You definitely want to utilize those tax codes if you can, and make sure your CPA is looking into that if you're making any of those big purchases for the office. Obviously, in pediatrics, we're not doing full arch cases. We're not doing a $30,000 treatment plan. We're doing more plug and chug. But over time, these things do pay for themselves and just make your day-to-day that much easier. And then this is some of my info, and this is some of the NeoLab Juniors info. Olivia is a great resource if you need anything. You can always just call straight customer service line. We've never had really any issues getting a hold of them if we have something going on with a case that we need to kind of run some questions by the lab on. And then this is my personal email. Like I said, if you guys have questions, you want to kind of chat about things, you're using it already and you need some troubleshooting, or you're looking to potentially purchase and you have some more kind of in-depth questions you want to keep more personal, hit me up. I'm an open book, and I can kind of walk you through any of that stuff.
So we can get to kind of the Q&A now. There's a couple questions in here, but again, if you have questions, please, please, please ask away.
Yeah.
So first one, what lab do you use? I know we've mentioned NeoLab, but you mentioned you've used a couple other labs for a couple other pieces. If you want to talk about your kind of full lab process for this.
I'd say I use NeoLab for 99% of my cases. I use Midwest for like a cosmetic technique. If I have a kid with peg laterals, I'll have my ortho set 7 and 10 up, kind of mid distance between the proximal teeth. I'll do a scan, send it over to the lab just with the STL file, and have them do a virtual wax up of what the anatomy of those teeth look like. I'll get approval from the patient, and then they will make me like a little silicone kind of suck down on those teeth. And then I use, like plumber's tape on the adjacent teeth, plug that little silicone. I do my bonding protocol, plug the silicone on. I pre-drill a little hole in the incisal ledge and fill it with composite, flowable composite. and then just cure and clean up. And it makes those cases awesome. One of my cosmetic friends who runs a very high-end veneer style office does that technique for some minimally invasive stuff. And that's really the only other lab I've used, just because NeoLab has been straightforward on all my appliance. And then OrthoBrain on my aligner side of things. You can use it with pretty much any aligner company except for Invisalign because they're iTero specific. But if you want to use Angel aligners or some other, Clear Correct, any of that, as long as you have an STL file, that lab's going to be straight to you. Not an issue at all.
Awesome. Thanks, Casey. So next one, this doctor joined late. So they were just, please share what scanner would you recommend for intraoral scanning, basically just for space maintenance and patient education. So, obviously this is about the AS200 and AS260, but if you want to talk about, I know you mentioned you've, used others in dental school. And if you want to talk about your other experiences and speaking with your, GP and everything
for
else.
me, like cost was a big one for me. Like, I will spend money to make money, but I'm not just going to blow money just to have a piece of equipment that I'm not going to use. So I wanted something that was going to be, easy to keep in the office, easy to move around the office. So I went with the little more expensive wireless one. I had mentioned earlier, I'm not sure, since you joined late, you probably missed it, but the size of the tip that's on there made it an easier choice, and the wireless component made it an easier choice. And the fact that they already had the built-in relationship with NeoLab made it a much simpler kind of integration. If you want it just for space maintainers and patient education, and you're not going to expand much more, go with the corded option. You'll save a little bit of money, but you'll still have the benefit of having those multiple tips that you can utilize. And then you can kind of utilize that on your day-to-day. And you will probably expand your horizons a little bit with it, just having it in the office, because it's going to sit there if you're not. You got to play with it and use it. It's just like buying a laser. If you never use it, it's not going to get you that ROI. But if you're using it and taking CE and kind of expanding your knowledge base, you can really kind of make it a differentiator in your practice.
Awesome. Thank you. So this one I can kind of answer, but if you have an opinion on this as well, go ahead and jump in. But are the scans compatible with any of the 3D printers? Yes, similar to kind of how you send off to a lab like STL file, but they're directly compatible with most of them. I don't know the specifics of which 3D printers. That's more of a question kind of for like Voxel. I can actually put you in touch if you had that. But that's kind of one of the things they specialize in is digital dentistry. And, if you have a 3D printer within the office, they can work with you on implementing that. Casey, are you doing 3D printing or anything there?
Not yet. I haven't expanded that far. I've got a lot of buddies that are more surgical and do a lot of 3D printing in their office. They've got like full labs in their office pretty much. And as long as you have an STL file, which you're going to get, that's usually what's necessary to do your 3D printing and stuff. So if it is something you want to integrate, Voxel is really cool. Talked with the owner. I think the first time I was introduced to this scanner, he was at the APD meeting when I met him. And he is very knowledgeable on the subject. They can walk you through all of the integrations and how, if you want to 3D print things in your office, say you want to start doing your own aligners in your office, they can help you through a lot of that. And there's a lot of different tech out there that is becoming more and more affordable and more available. I'm in the process of doing an expansion on my existing office, and I actually had them integrate like a smaller lab section. And I'm like, I don't know what I'm going to do with this, but in the future I may 3D print, and I want to have a place to 3D print if I get into that. So I'm always kind of thinking to the future. If I knew a little more personally, I can indulge a little more, but I don't 3D print yet. I just see the cool stuff my buddies make, and it makes for some pretty customizable cases.
Sweet. Thank you. Next question is for sedation cases. I love the idea of having appliances prefabricated. I'm assuming not much you can do if you have to crown the tooth you are placing the spacer on. Are you doing more class 2s as a result?
So I wouldn't say I would, if a tooth needed a crown, like if it really needed it and I'm in sedation, I'm placing a crown. Like I'm still going to be pediatric dentist first. Like I'm not going to want to go back and revisit that. If it's a pulped tooth or really big breakdown, I'm not doing a lot of MODs and sedation. I'll do some EMO or DOs if they're small proximals, but if I have multi-surface or cervical DMN or any of my indications just from a pediatric board side of things, I'm going to crown the tooth. But most of my cases that I'm doing an appliance on, if I'm getting it fabricated from the lab now, it's going to be on a 6. So it's going to be on a permanent tooth. And I don't crown a lot of permanent teeth. I like to be very conservative with enamel. That's more of my practice philosophy. I don't want to leave goop under a big stainless steel crown for 10 years. So I haven't gotten to that situation a lot. If I am like crowning an E, and I need to have a band and loop or something, I'm gonna use the chairside kit now. I've utilized that a ton in sedation just because it's quick and easy to use, and I've had good success with those space maintainers so far. But yeah, I guess if say I was like crowning number 3 and I needed a place in Nance, I would probably scan and then deliver down the road, just because I don't know how you could kind of integrate that aspect into it. I think theoretically, if you really wanted to get outside the box with some of that newer 3D printed like full coverage that they have, you could probably scan the tooth and have them indirectly make you like a 3D printed crown on the tooth. I don't know. I'm kind of thinking outside the box with it, but the fact that they can like 3D print any style band, I would think they can fabricate a crown in that same stainless steel material. I don't know if that's like gold standard kind of clinical dentistry, but we do a lot of things in dentistry that are a little MacGyvered and a little different depending on your patient population and kind of what the case calls for. So I guess you could try that if you wanted to, but I wouldn't say I sacrifice doing class 2s. If it needs a crown, I'm going to crown it. Good question though.
Awesome. This one I'll answer. Point of contact to get a demo in Ontario, Canada. That'd be myself. So I'll type just my email in here so that you can have it under the answered tab there. If you click over, and you'll see my email there. So you're more than welcome to reach out. Happy to speak with you and see what we can do. So we're kind of getting a little late here. There's no more questions in the queue. So if we want to wait around just for a couple of minutes, see if anyone has any other questions, please throw them in here while we have Dr. Casey Lynn being able to help answer these for you. Anything else, Casey, you want to add? Anything?
No, I mean, I'm a big believer in trying new things. If it's something you've been like thinking about, I think I thought about a scanner for like 4 years before I pulled the trigger on a scanner, just because they were too expensive in a sense. Oh, thanks, Michelle. I'm glad to be here. My best recommendation is jump in, dive in, get it going, and see what you can do for your patients. You'll enjoy it. It's a cool piece of technology, and I'm very happy we have it. Whenever I used to kind of worry about how am I going to get that impression and how am I going to deliver that, this has made those answers much easier. And for me, it's just peace of mind knowing that it's going to fit every time and I don't have to think about it.
Awesome. Well, oh, nice. New Smile help with marketing. Not necessarily, but what we can do is any material we have posted on our website, YouTube, anything else, you are more than welcome to use. We allow you to use everything. If you're looking for something specific, you're more than welcome to reach out to us. I can see what our marketing team has. We get this question all the time on like the sew-in side. I know Aaron has gotten this a bunch, but anything we have that I can give you, we will. You're more than welcome to reach out. We don't come up with like a marketing plan per se, but anything that we have in material on the website, brochures, pamphlet kind of stuff, anything like that, we'll pass along to you. If you reach out, we're more than happy to help. Aaron, anything to add on that front?
Yeah, I would say just also find, like Jordan can let you know other doctors that are using the scanner and like what they're doing, check on their websites and like kind of, use, don't reinvent the wheel, just kind of like go off of like what your colleagues are doing. Most people are happy to share.
Yeah. Casey, anything to add on that front as far as market? Are you marketing the scanner at all? Or are you doing?
Yeah, well, we did some social videos that are going out. My girl's got like a queue of things. I haven't seen it trickle out yet. And we're doing a website redo because I'm bringing a new associate in and we're kind of redoing all that over the summer. So the new site's going to have a lot of this integrated into it. But we've already done the pre-filming and the pre-pictures and all that kind of stuff. I talk about it a ton when I'm doing things with the parents. In my opinion, parents talking to each other in your community gives you the best ROI on marketing. I don't spend a ton on marketing at all because we cater so much to the patient population and just providing a ridiculously exceptional kind of experience in the office. That's what's going to market you. But if you are on social, do educational videos on it. We'll do educational videos on different tech we use, whether it's our laser, the SOAN, the scanner itself, and just get yourself out there. It doesn't need to be super professional looking. People actually like not professional more than anything. It really just helps you become kind of more ingrained in your community, and people will be like, hey, that's the guy that has that new tech. Like, let's give him a try. And it will help you in the long run.
Awesome. Thank you for that.
I would say also like just anything, like I have 4 kids myself. So anything that gets the kids in and out of the chair faster, it's great for you as the dentist because that's more money for you, the more patients you can get in your chair. But for parents, they don't want to be there any more than, you want them to be there. So if they can get back to school and the parents can get back to work, I mean, that's the best selling point to me.
Absolutely.
Awesome. Well, I think we're just about good.
I want to mention one other thing, actually. Sorry.
Go ahead, Aaron.
So Dr. Lynn mentioned that like saving space. I love organizing and I like everything to be really like cleaned up. So Dr. Lynn mentioned that like, you don't have to store your alginates anymore because you can have all your scans digital, but you can also, Jordan mentioned this in his training with me the other day, you can also scan your old alginates that you're storing and make digital files of those. And then you can toss all of those, which I was like, that's amazing. Cause I'm sure you want to get rid of all of those. So
yeah, that's really smart. Yeah.
Did you end up doing that, Casey?
I've only got maybe 15 models, but I'm probably going to one of my girls do it just so I can clean out that drawer.
Yeah, exactly.
Again, thank you all for joining. Y'all have a great, great, great night. Casey, I appreciate you so much. Thanks so much.
Guys. Everybody have a good one.